With COVID-19 infection rates surging across the country, senior living providers are once again tightening restrictions. Atria Senior Living has consistently emphasized the importance of COVID-19 testing as a cornerstone of its strategy. Joining me now is CEO of Atria, John Moore. John, good to have you with us. Just to paint the picture for folks who aren't familiar with your facilities, you have over 200 communities in the Northeast. That means over 20,000 residents, more than 14,000 employees. Those are a lot of people to be testing. How are you doing so far?
So it's actually, we're spread across the country. We're in 26 states, heavy concentrations in the Northeast between New York and Boston, and then also in California. And then we're also in just about all of the big markets across the country. So it's even more complicated than that to put together a testing program that can go anywhere. We were very fortunate mid-April to have been introduced to somebody at Mayo Clinic Labs. We thought that we were going to do a testing program then, a baseline test of all of our employees. So, and then a few more. We thought it would be 18,000 tests. And Mayo Clinic Labs said they could support us. Here we are several months later, and I think we're over 160,000 tests. We'll do 12,000 tests this week. And we've been able to, the more we use testing, and we were pretty early in the testing game. So mid-April, testing was largely unavailable in scale. One of the reasons that that Mayo got excited about working with us is that we wanted to do full asymptomatic testing of everybody coming to work, and through that we identified over 100 asymptomatic positives. We were able to screen them out and let them heal without exposing other people. The result is our disease curve. We think has looked, even taking care of frail seniors, our disease curve has looked. It has a better shape since then than if you look at what the disease curves look like in the markets that we're in. Since then, and once we started to understand the benefits of testing, states began to require lots of testing, particularly New York. Is still required, testing once a week of all staff. But we started to overlay other programs. So anytime there is a positive result returned, either through our testing or through any testing that a resident may have at a doctor or a staff member may have outside the community, we immediately trace and we'll do testing around that test. All new hires are tested, all new move-ins are tested, move-ins are double tested, and residents that return from a medical setting are tested as well. And it's having the ability to have a partner like Mayo with go anywhere testing. There's a network of 200 couriers that supports our testing program. And again, we're at this point we're doing this week. We'll be doing 2,000 tests a day over 6 days. So it's become a pretty big endeavor.
That's for sure. And I know that the vaccine, they tell us, is on the way. And the CDC has said that frontline workers and those in nursing homes would be among the first to get the vaccine. I know you're not a nursing home. You actually make the distinction. You're a senior living facility. So there is a difference there. But have you heard from officials? Where would your facilities, your residents sort of be in the order of people receiving the vaccine when it is finally available?
Well, we're watching that closely. As you could imagine, the very good news is yesterday, the CDC, the committee that gives guidance to the states about what they suggest people should do with the vaccines, voted nearly unanimously to include senior housing residents in phase 1A. So as you know, there are several phases identified. Phase 1A is for frontline healthcare workers. Our staff was already clearly in phase 1A. There's phase 1B and phase 1C. So they changed their guidance yesterday to include senior assisted living residents in phase 1A. They also included a phase 1C that would pick up all other frail seniors even living at home. So there was quite a move yesterday to add seniors that are exposed and at higher risk to the vaccine programs. We still have to wait for what states decide to do. And there was some late breaking news. It was as I was getting ready to talk with you. Understand there was a press conference going on in New York about what they think they're going to do with the vaccine. But we have to now wait. We're told that usually the states will take CDC's recommendation, but they don't have to. So we have to wait for that. The big dates, I think, as you know, that we're watching, that everybody's watching. The EUA hopefully for Pfizer comes on December 10th, and for Moderna on the 17th, and hopefully things can start rolling after that. I mean, we fully expect frontline staff at hospitals to be absolutely the priority, and that's also good for our residents because our residents are consumers of healthcare, and one of the ways that we've seen them get exposed is exposure to healthcare settings. So I think that's a key thing for everybody. So the vaccine is exciting. Yep.
We just got past Thanksgiving. That's okay. I wanted to get one more question in here to you that, we've got now the Christmas holiday, Hanukkah holiday upon us, the new year. How are you telling families and staff and residents to do this and to stay healthy?
Well, for Thanksgiving, we encourage residents, not to go out. We tried to talk about, we provide as much help as we can, virtual connection with family members. Basically, this may be a year that we need to be thankful. We need to be thankful for a lot of things every day. But there's no reason why we can't have Thanksgiving in January, February, or March. It's one day, but just for everybody, the smart thing to do is to stay safe for residents. And we know that residents and families will want to get together in any event. So we provide a mechanism if they do go out. We would quarantine them, and we would offer testing. We would offer to test them for a price for those tests, but a vehicle to let people do as safely as we can, let them do what they need to do. It's interesting, as Thanksgiving approached, we had, we thought, a large group of residents would go home for Thanksgiving, and many of them, decided with family members that the smart thing to do was to have a virtual connection, everybody to be safe, and let's get past this. The vaccine's exciting news, and that's a good thing.
Absolutely. I'm glad to see that people didn't let their emotions overtake them, and they tried to do the right thing. John Moore, CEO of Atria, thanks so much, and best of luck to you with all that testing.
Thank you, and thanks for including this kind of conversation. It's very helpful.
Absolutely. It's an important conversation. Thank you.